I chose Duke for my fellowship training because I felt like it was the perfect mixture of all the things I was looking for in a fellowship. I was looking for both excellent clinical training, research support, and an environment of just mentorship and community, and I felt like all of those things were present at Duke. In terms of the clinical training, what I loved is the balance of laparoscopy and robotics, specifically in gynecologic oncology, being really skilled at both of those things, including staging procedures, both laparoscopically and robotically, was a huge priority for me. And it's been very true that I feel very competent in both laparoscopic and robotic, and of course open surgery. And I've been so impressed with the clinical training here. In terms of the research, the first year of fellowship is entirely protected research time. There are no required clinical responsibilities, which is pretty unique about Duke. So not only is that great for your quality of life, but it really allows you to fully invest in your research. And under the guidance of Dr. Havrileski, she almost makes it impossible to get off track on your research projects. There are so many amazing mentors here, both inside and outside of the department, and opportunities for funding and guidance if you've never submitted a grant to understand how to do those things. You're really not on your own. There is really a lot of structure here to help you succeed in whatever research you want to do, and that includes basic science translational or more clinical projects. And then lastly, I just got a really good feeling on my interview day, even though it was via Zoom. I felt like I had good conversations with the people. They were people I would want to spend time with in work and outside of work, and that is, very much proven to be the case since I've been here. These are a community of people that really want to support you in your personal and professional goals. The clinical experience at Duke is a great one. So you're on a team with one other fellow. So there's a senior and a junior fellow and a team of 4 residents, as well as medical students. Sometimes there's PA students, and then we of course have other NPs, PAs, and nurses, and many other support staff as part of the general GYN oncology team. But as the fellow, you really are the leader of the inpatient service. The 2 fellows get to take care of the patients in the hospital together. So every morning you round on the patients in the hospital, you make plans with the residents, and then 3 days of the week, you're typically going to the operating room, and the other 2 days of the week, you're in clinic. And so each week has a balance of 3 days in the operating room and 2 in clinic. And that's a really nice balance, I think, because it's very much similar to what life is like when you are an attending. You are balancing the operating room and clinic, you're taking care of the inpatient service, throughout the day. In the morning, you're checking in at night. And the attendings really give us a lot of ownership over the service. You round with the attending who's in the operating room that day, but they really defer to the fellows to make a lot of the plans and kind of approve them and are supportive of us, but they allow us a lot of autonomy, which has been really important for our growth. The other really unique thing about the Duke clinical experience is that the 2 clinical fellows are on service together, meaning you're not alone as the only fellow. You always have your co-fellow to go to, which both I think is incredible for education, especially when you're the junior fellow. You have the senior fellow to ask your little questions to that maybe you don't want to ask the attending, but it really creates a lot of camaraderie and is amazing for your quality of life. We now have 8 attendings because we just hired somebody new, and we have a really high volume of both complex cases and some more straightforward cases, almost a 50-50 exact balance of laparoscopic and robotic cases for our minimally invasive volume, and then of course plenty of open cases, including radical hysterectomies, vulvectomies, groin nodes. So I've gotten a wide breadth of experience, and I will feel very confident going into practice. So what I'll remember most about my time at Duke is not any one big moment, but just kind of the little day-to-day moments, the times on rounds that, we have tough patient situations and we're able to get through them together, or, even find our way to laugh about hard situations later, or where we help each other through a challenge, or we're just joking around and having a great time in the workroom. I feel like this is a community that is incredibly supportive of each other and can have fun together during light moments and can also support each other through dark moments. I will have this one particular moment I will always remember with our division director, Dr. Burchuk, who taught me what it really means to take care of patients when we were waiting on a CT scan for a patient we were worried about on a Friday night, and transport hadn't arrived yet and they weren't arriving. And so Dr. Burchuk and Georgia and me, at Dr. Burchuk's request, wheeled the patient down to the CT scanner ourselves. And that's the type of people that work here at Duke that are kind of just here to do the job, and they set an example of kind of integrity and patient care that I will always remember and I will always strive to achieve. My career goals are to be an academic GYN oncologist, so I hope to work at an academic center similar to Duke where I can find that balance between the base thing, the thing that I love the most is clinical care and taking care of patients, so I would never want to lose taking care of patients, but I also love being in an environment with learners, students, residents, and I'm hoping to kind of figure out over my early career years what exactly is my research focus. I've done some work in quality improvement and I've done some basic and translational work, and I will continue to reflect and think about where I want my niche to be, but I look forward to a career, hopefully in academic GYN oncology, where I can mostly take care of patients, but have that sort of intellectual stimulation through research as part of my time, and of course always interact with trainees and students and keep that sort of lifelong learning going.